Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the sixth video of repeat revision course of Endodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about pulpal calcification. In pulpal calcification we will discuss about different types of pulpal calcification like dystrophic, diffuse, denticles are also known as pulp stones. We will discuss one by one. First we start from what is pulpal calcification. Here a part of the pulp tissue is replaced by calcific material. For example, pulp stone are also known as denticle are formed either within the pulp chamber or root canal. Now when we open the pulp chamber or root canal, there will be pulpal calcification stone in the pulp chamber, and there will be difficulty to find the canal. And next, in the pulp canal there may be calcification. In the result there will be resistance while we entering the file. Now there are three types of calcification. Number one is dystrophic, second is diffuse, and third is the denticle or pulp stone. First is the dystrophic calcification. Now what is dystrophic calcification? If calcific material present in the dead or degenerated tissue. Now what is dystrophic calcification? Occur by deposition of calcium salt in dead or degenerated tissue. Occur in minute area of young pulp affected by minor circulatory disturbances. If there is a minor circulatory disturbances in a young pulp, there will be death of that area. In the result there will be dystrophic calcification, mean calcium salt will be deposited in that area. In blood clot or around a single degenerated cell, mean around a blood clot or around a single degenerated cell, this dystrophic calcification can occur. It can also begin in the connective tissue walls of blood vessels and nerves and follow their course. Mean this dystrophic calcification can begin in the connective tissue walls of blood vessel and nerves and also follow their course. Next is the diffuse calcification. In diffuse calcification generally observed in root canals, the deposit become long, thin and fibrillar and fusing. Look at here in diagram, there is a white long calcification which are diffuse calcification throughout the root canal. Now come to another diagram. Here this is the below the pulp chamber there is a root canal, and in the root canal there is a, here in pulp chamber there is a pulp stone, and root canal there is a calcification, diffuse calcification in the root canal. And when we take a radiograph, how we can identify diffuse pulpal calcification? Normally inside the tooth, the root canal area where there is a nerve, this area on radiograph there will be radiolucence, means center of the tooth. The pulp area will be radiolucence, and the above enamel and dentine area will be radio opaque. But in calcified canals, the canal will be look radio opaque, not radiolucence, because the radiolucence pulp chamber area pulp canal area is replaced by calcific, mean calcium salt. Now when we take radiograph, there will be no reducence area inside the tooth. This show a calcification of the root canal. Now come to the after diffuse calcification. Now come to the third types of calcification, which is the denticles or pulp stone. Look at on the diagram on the left side. In denticle or pulp stone, the stone are formed inside the pulp chamber. And when we take radiograph, there will be normally the pulp, the root canal and pulp chamber are radiolucence on radiograph. But look at the red arrow in the pulp chamber radiolucence area. There is a white radiopaque area, which is the pulpal calcification, which is a pulp stone inside the pulp chamber. And here, when we dissect the tooth, this is the pulp stone or denticle in the pulp chamber. Again here in the pulp chamber, there is a pulp stone or denticle, and this pulp stone will create difficulty to finding the canal orifice. Then this pulp chamber we can remove through the burr, and from the root canal we should use EDTA to dissolve this calcific material to open the canal. Now in denticle or pulp stone, there are two types. One is true denticle, second is false denticle. True denticle is found by dentine, but false is found by here. The mean false denticle have no dentine and they are found mainly from dead tissue. Now the true denticle are composed of dentine and found by detached dentinoblast or fragment of Hertwig sheath, which may stimulate undifferentiated cell to assume dentoblastic activity. Second, the false denticle are found when a degenerating tissue structure serves as a nidus for deposition of concentric layer of calcified tissue. These two types are very important. True denticle or true pulp stone, and false denticle or false pulp stone. And true denticle is always found by dentine, but false denticle is found by degenerating tissue. Now, pulp stone are considered harmless, although referred pain in a few patients has been reported, but they may cause difficulty in finding the canal orifice. In the result, there will be, if we place the file in the wrong area, there will be perforation. And in a root canal, there will be more chances of ledge formation. Now this is all about our today lecture, which is the pulpal calcification, and this is very important for clinical as well as for theory exam. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.